Assalamualaikum and greetings to Madam Hartini. Today my team and I want to present and debate the topic that has been assigned to us, which is the Usher syndrome. But before we do that, I would like to introduce my team member who had dedicated their valuable time to conducting research on this disorder. The content that my team member and I are going to present is the introduction to Usher syndrome, the clinical symptoms, genetic causes, diagnosis, and disease management for the Usher syndrome. Bismillahirrahmanirrahim. My name is Muhammad Zawi Irfan bin Siddiq, and I will now provide an explanation of the introduction of Usher syndrome. As you can see, Usher syndrome is a genetic illness inherent within families. A syndrome refers to a collection of symptoms that occur simultaneously. Usher syndrome is defined by simultaneously impairment of both auditory and visual function. The degree of hearing loss might range from little to total loss. The medical condition is referred to as retinitis pigmentosa. Over time, the retinas of the eyes undergo gradual deterioration. The retinas receive light and are crucial for vision perception, for us to see things, objects in front of us. Usher syndrome is a prevalent juvenile disorder that affects both vision and hearing. Next, furthermore, these are types of Usher syndromes that are currently known to us, and that is Usher syndrome type 1, Usher syndrome type 2, and Usher syndrome type 3. Based on data that we discover, type 1 usually associated with the characteristics which are profound death from birth, severe balance problem, and blindness eventually occur. Continuing for type 2, moderate to severe hearing problems, normal balance, use speech to communicate. And last but not least, type 3 usually shown characteristics like born with normal hearing, near normal balance, deafness by late adulthood, meaning that the symptoms come later in their life. These are several clinical symptoms that can be discovered while identifying whether the individual possesses traits that can link them back to Usher syndrome, and that is auditory impairment or hearing loss, vision loss, it can be varies from person to person, retinitis pigmentosa, and imbalance delay motor development, meaning that the person could not balance themselves even with smooth ground. That's all from me. I would like to pass to my team member to continue discussing about this syndrome. Thank you very much.
Genetic causes of Usher syndrome. As mentioned in the introduction, there are multiple types of Usher syndrome, but let's narrow down our knowledge towards the most common types of Usher syndrome, which is Usher syndrome type 2. To break things down to be more specific, the Usher syndrome type 2 also involves multiple genes that causes it, such as USH2A, ADGRV1, and WHRN. In this case, we are going to delve into USH2A gene, which are a frequent cause of Usher syndrome type 2. USH2A gene is responsible for productions of usherin protein. Usherin protein plays a vital role in the development and functions of sensory cells, including the hair cells in the cochlea, which involve in hearing, and the photoreceptor cells in the retina, which involve in vision. It is a structural protein expressed in the basement membranes of the cochlea and the retina, which is localized to the long arm of chromosome 1. In the context of USH2A gene, a missense mutation may take place in the productions of usherin protein with a different amino acids at a specific position. Note that missense mutation is a type of point mutations where a DNA change that results in different amino acids being encoded at a particular positions in the resulting protein. For example, if there is a nucleotide substitutions, in this case as we can see from E to G substitutions at a specific position in the USH2A gene, it can result in the replacement of one amino acid with another in the usherin protein. Now, the altered amino acids caused by the mutations may affect the normal functions of usherin protein. Therefore, it will result a dysfunctions of cochlear hair cells which leads to severe congenital hearing loss and degenerations of photoreceptor cells which cause retinitis pigmentosa. Other types of mutations may also contribute to the syndrome, such as nonsense mutation, frameshift mutations, splice site mutations, and large deletions or incisions.
Assalamualaikum warahmatullahi wabarakatuh. My name is Maraizati binti Azmi. I will continue this presentation with diagnosis. To diagnose Usher syndrome, there are several tests we can use. First of all, we can use MRI or CT scan. For CT and MRI scanning, they are important to evaluate sensorineural hearing loss. CT imaging provides a high-resolution pictures of the bony structure in the ear. MR imaging, however, can use to demonstrate or visualize the actual vestibular cochlear nerve, and we can actually see what is going on in the inner ear that cannot be seen with the naked eye. Second, audiology testing. It is to measure the degree of hearing loss and determine the signs of deafness. Number 3 is we can use electroretinography, which is to detect dysfunctional rods in the retina caused by retinitis pigmentosa or the degeneration of the retina itself. Next is vestibular assessment, which is to determine the level of motor skill development and also detect imbalance of the body due to the vestibular nerve degeneration of the inner ear. Next is vision exam, which is conducted early to detect peripheral vision loss or tunnel vision and also measure the degree of visual capability since the symptoms for Usher syndrome varies among patients. Last but not least, we can use genetic testing. It can detect specific genes mutation occurred in the patient that can be diagnosed as Usher syndrome. However, atypical type of Usher syndrome might be difficult to detect using this method. Genetic testing results usually used for research and development purposes to help with producing treatments in the future. That is all from me. Thank you.
Presently, there is no cure for Usher syndrome, but it is good when it can detect and give the treatment early so that they can manage their hearing, vision, and balance problem. For the vision problem, patient can use low vision aid and undergoing vision rehabilitation. It can help people with this syndrome make the most of their vision. Also that the patient also can learn how to read the braille writing so that they can read without seeing the word. Vitamin A also can be consumed because of it may help to reduce development of RP, which is retinitis pigmentosa, but it can have serious side effect if taken too much, so it needs to be consulted by a doctor first before consuming it. For hearing problem, patient can use hearing aid or assistive device, for example, audio induction or FM system that can make sound louder. The best suitable device that can choose can be consulted by an audiologist during the auditory or hearing training. Also that the patient can do in cochlear implant, which is a complex electronic device that can help to provide a sense of sound to a person who is profoundly deaf or severely hard of hearing. The last one is learn the region sign language. For imbalance problem, the patient can do the physical therapy and rehabilitation conducted by therapists. It can help to compensate for imbalance, adapt to less balance, and maintain physical activity.